I came to working in residential aged care with a sporting physiotherapy lens on because that was my background. And I was really excited to be able to take those skills and bring them into the setting where people were functioning at possibly 20 or 30% of their potential and then be able to double or triple it for them. And then I was flabbergasted to find out early on that that kind of physio isn't funded in residential aged care. In fact, it's discouraged. Really, we're working with maintaining people at their current level and doing treatments that for the rest of physiotherapy world have been outdated 20 or 30 years ago. So I just decided I needed to either get out of that system altogether or I needed to try and help to change it. So I decided to change it. We designed a study, a randomised controlled trial, which included 16 residential aged care villages and 221 participants. So people that volunteered for the study ranged in age, but the mean age was 86 and the oldest one was 101. And so half of the group exercised and the other half of the group just carried on life as usual. And the exercise involved bringing a gym into the village and conducting classes for 2 hours a week where people came and worked out on the gym equipment and did some fancy footwork so that they could learn to react quickly if they started to fall. We measured falls and physical performance and a number of other secondary outcomes as our measures, and we followed them up over a 12-month period. So the study went on for a period of about 5 years, but the outcomes were really fantastic when they came in. And we ended up demonstrating that the falls rate was reduced by 55% in the people that did the exercise program, and their physical performance was also improved significantly. These had huge ramifications for the healthcare system, for the people that look after older people, because it's traumatic seeing them fall and decline. But more importantly, it really helped the residents themselves to feel proud of what they could achieve and to be able to just participate in so many things that they just couldn't have done without the exercise program. This was a personal goal of one resident who was basically bedbound, and he wanted to be able to go home and spend some days at home on his own with his wife, like date days. And so we worked with him to try and build up his ability to get up and transfer in and out of a wheelchair and in and out of a car. And then I was able to take him on a date day with his wife, and they went home and spent the days together. And he didn't live for a lot long afterwards, but his date days just brought them so much joy for the rest of his days. So my favourite stories was at the 20th anniversary of the opening of Feros Care where I work. And we asked the residents what things are still on their bucket list that they haven't been able to achieve. And the winner by vote was riding on a Harley Davidson. And so we organised for a big 4-seater Harley Davidson to rock up to the village. We only rented it for 1 hour, complete with the fuzzy wuzzy beard and the John Lennon glasses rider on the front. And it had 3 seats across the back, and the residents climbed on and he drove them around Byron Bay, high-fiving backpackers as they went past, and they just had such a lot of fun. And he ended up being there for 3 hours because we just had a big long line of wheelie walkers waiting to have a go on the Harley Davidson. I mean, these are the stories, these sort of programs enables people to have fun and do what the rest of us want to do, enjoy our lives. Falls create a huge burden for our health economy. It's been published that falls actually cost the health economy more than any form of other trauma, including motor vehicle accidents. And so we carried out a cost effectiveness analysis as well, so that we could look at not only just the physical and personal benefits of the program, but also from a health economic perspective. And we found that for every fall that was avoided, there was $670 saved. So that equated to about $120 million per year saved for the health economy. We have been really excited about the figures and the evidence that we can now use to try and lobby for change. But to be honest, the thing that's really meant the world to me has been seeing how using the program has changed people's lives, that they've been able to participate in things that they never could have done beforehand, socially and personally. And just to see their pride on their faces, it really makes the world a difference. It really is my dream that all of this work will end up in revisiting the way that we fund aged care and really making a change so that we can emerge as world leaders, giving our older Australians the best possible kinds of treatment.